are ensuring our online components are working, so maybe give me a thumbs up when we feel good. We have English and Spanish. Yeah. There you are. Where'd you go? For Spanish language interpretation, anything you need to say for folks in the room? ¿Alguien necesita traducción? ¿Está bien? Okay. And we have the Spanish slides are right on that smaller screen. And I think we have 11 or so people online, so hybrid in this new day and age. All right, so let me officially start then. We're good to go. It was wonderful to see for a split second some of the faces who are online, and we have a number of folks in the room. It is now good afternoon, everyone. My name is Chandra Alexander. I'm the CEO of Community Action Marin. Today, myself, our staff, and all of the community members with whom we've engaged over the past, Patrick, how many months?
About five and a half.
About 5.5 months. Kinds of expertise we have developed as individuals and certainly as an agency in the past couple of years. It's been incredible, right? We've learned a lot. We have about 11 or 12 individuals online, so know that they are all with us behind the screen. We'll hear a little bit more about the population that we surveyed, but I do want to welcome you and thank you, and I want to say thank you to our staff, many of whom are here along the sides, who will be presenting with me today for Community Action Marin's 2023 public hearing in response to our Community Needs Assessment and Community Action Plan. Again, I'm Chandra Alexander. I'm the CEO of Community Action Marin and very delighted to be with you. A little bit about our agenda here up on the screen. I want to make sure that you all know this is being recorded. We are videoing, we are recording online, we'll be taking some documentation, photographs, and also ensuring that you are represented by signing in either online or in the back of the room so that we have a record of this meeting. This, at the highest level, is a way for us to do a couple of things. One, listen and respond to the needs in Marin County. And this is a way to say that we have done the assessments that we need to do as a community action agency. But importantly, it's also about, at the federal level and state level too, ensuring that all of those in Congress who are responsible for allocating apportionments of taxpayer dollars to support anti-poverty work throughout the country know that the work is producing results. That we're listening deeply in community, that we're working in partnership with community, and that we're advancing an anti-poverty agenda across the country. And this helps to ensure that year over year, agencies like Community Action Marin, national community action agencies get the funding they need to do this important work. And in Marin, we know that the work that we do is very much about racial justice, and it's about a commitment to helping to support families and communities of color and of low income to get to places of self-sufficiency, stability, and thriving. So welcome to everyone. We're going to talk today, and the team will introduce how we came up with what we're presenting today. We'll engage your questions, and we invite you to participate and ask questions throughout. If you're online, feel free to use that chat. We have Alana and Shuda and Mimi helping to support that process, in addition to online translation. And I think we can just dive in. All right, so welcome again to everyone. Thank you for being part of today's important work to ensure that Community Action Marin, our over 200 staff, are engaging with community meaningfully toward better outcomes for individuals, for families, for people across generation, and for our community writ large. The mission that we have is to ensure that we support, you can go back one, the well-being by providing the vital services people need. Community Action Marin does many things in community. We're known for high quality, free, and affordable childhood education. You'll hear a lot more about that as we delve into the service areas. But what we do is needs responsive, so that what we do today and how we work today may not be exactly the what we do tomorrow. We want to make sure that we're maintaining that responsiveness within our community. So we'll talk a little bit more about that. But again, our commitment is to the well-being of people across generations in our community, across the entirety of the county. Again, as I mentioned, we do form part of a national network of community action agencies, and in fact, our roots go back to the Civil Rights Act of 1964 and also the Economic Opportunity Act, also of the same year, 1964, and LBJ's War on Poverty. Those two strands of economic justice and racial justice are the DNA of who we are as a community action agency today, and we're really proud of that heritage, but also in the commitment that each of our staff members bring to the work that they do in service to better outcomes for our community. So we have to do community action planning every 2 years. We commit day in and day out to listening and being in partnership with our community. But it also means that formally we have to reach out to community and listen and hear and engage in deep work to understand, not just hear words, but to really understand, not just get data, but really understand what is our community saying. And we partner with others across the county, Health and Human Services, County of Marin government, other agencies, other community-based organizations, to ensure that we are thinking together and doing what we can do to listen deeply through all of our areas of expertise and come together to ensure that we can be as responsive as possible to what our community urgently needs today and we anticipate will need tomorrow. The California Department of Community Services and Development at the state level is who we're responsible to, and they're responsible to the federal government. So they act as the state level agency to which we're responding to ensure that this action planning happens thoroughly and robustly, and that we, of course, are engaging with each one of you in this room and online to further the objectives of our mission at Community Action Marin. So again, thank you for being here. We can't do this without you. So I think I'm going to turn it over to my colleague Rob, who's been an incredible lead on this. So Rob, I'll let you introduce yourself and take it from here.
Hi, I'm Rob Palmer. I'm the Director of Learning and Evaluation here at Community Action Marin. As Chandra mentioned, as a community action agency, we need to understand the needs of the community. And we do that with data, and we've got various data sources. So we've got government sources, federal, state, and local. For example, the U.S. Census is a great source of data information that's going to run through this presentation. We also get data from other organizations and through the work that they do. A couple of good examples that we use is the California Housing Partnership and the Race Counts report. We also generate our own data. So we've got program data from within CAM, and we also do surveys. My colleague Patrick's going to mention in a minute about the recent community survey that we did. And last is qualitative data. And that's really going beyond the numbers and talking directly to people in the community. We do that through talking with clients, we do it through focus groups, and through the answers to open-ended questions in surveys. And it's very helpful to hear directly from people in their own words to supplement the numbers from surveys. Pass it over to Patrick.
Yeah, hello, I'm Patrick Wales-Dinan. I manage data analytics here at CAM. And yeah, as both Chandra and Rob mentioned, kind of the first step to having that understanding of what's going on is being able to actually collect some data and see what it tells us. So we ran a community needs survey in which we reached out to hundreds of people in our community, and we got 596 responses from Marin residents. We conducted the survey over about 2 months, and we distributed it in a number of ways: email, text, and through outreach activities that were run by people in our CAM network. This is some of the high-level data that we got back. And keep in mind, the purpose of the survey isn't to necessarily represent Marin County. The purpose of the survey is to represent the people who we are hoping to serve here at CAM who live in Marin County. So we feel very strongly that the distribution of participants is fairly accurate in terms of the groups of people who we are trying to reach. So as you can see up here, 61% of the people who participated in this survey were identified as Hispanic, 25% as white, 7% black, 5% multiracial, and 3% Asian. And I think even more importantly, the amount of people who are in the lower income bracket was incredibly high, right? So over 50% of people who responded to our survey indicated that they make less than $25,000 a year. And you know, I think to imagine how you can survive on that level of income in a place like Marin County is kind of unbelievable. So we feel that everything that you're going to see from here on out represents the voice of those people who have you know, immense need and live in a community of like extreme inequity.
Hi all, I'm Erin Hawkins and I'm the new Vice President of Programs here at CAM, and you're going to see me pop up occasionally throughout this presentation to help shepherd questions that you might come up with as we're watching the presentation and going through the data. So we wanted to give everyone a chance to kind of see the guiding questions that we'll be using today. First of all, we want to know what you think, right? Are there needs that you are maybe not seeing in the data, that you are seeing in the data, that show us the pain point or the greatest concern? Do they align with what you observe and what you see? Where are the gaps? And more specifically, given those gaps and given our current community programs, we would love to hear your thoughts on needs that are not yet represented in what CAM provides and services we do. That's an incredibly important question for us. And then finally, we'll check in on priorities. Given how dynamic both our needs and our strengths as a community, what they are and how they intersect and how, we'll say, dynamic they can be, have we picked the right priorities to focus on, I would say as an agency, but also as a community. So just throwing those up there now to get you percolating as you start to sit through some data. And I'll pop back up in a couple of slides and we'll talk through it.
All right, so back to me. So this next set of slides is going to focus on some various areas of inequity in our county. So the first slide is focused on race. You see two pie charts here. The pie chart to the left is looking at the entire Marin County population. One on the right is looking at the subset of Marin County population living in poverty. We focused on the four most common racial and ethnic groups in the county. And so on the left you can see, we're going to focus on a couple of groups. You can see that 17% of the residents of Marin County identify as Hispanic, and 2% identify as Black. You look at those same two racial and ethnic groups on the right side, 32% of the people living in poverty in Marin identify as Hispanic, and 5% identify as Black. So that's a very stark inequity there, that you've got 19% of the population represented by those two ethnic and racial groups, yet the same people represent 37% of those living in poverty. Next, we're going to look at age and geography. So on the left side of the slide, the overall poverty rate in Marin County is relatively low, 6.9%, but that still means there's over 17,000 people, all of our neighbors and community members in Marin County who are living in poverty. And when you look at that subset of just kids under 5, that rate jumps up to 8.6%, with over 1,000 children under 5 living in poverty.
Our needs survey and our needs assessment was food insecurity among different groups. And so we, for the purposes of our survey, we defined food insecurity as anybody who said that they were worried that they would not have enough money to buy food after their current amount of food ran out. Okay, so anytime that happened in the last 12 months, if someone said yes to that, they were identified as food insecure. And so you can see among our respondents from this survey, we had 73% of the Hispanic population who responded to our survey also identified as food insecure. You counter that with only 56% from the white, multiracial, and Asian demographics. And then the Black population, that was even more stark. So 82% of all respondents who identified as Black to our survey also said that they experienced some level of food insecurity in the last 12 months. Okay, so this is a slide about housing inequality. Okay, so I'll take a second to make sure that everybody understands what we have here. So we have 3 different levels of income here. So people making 30% of the median income, okay, or less. And so those would be severely impoverished people. People making 50% of the median income or less, or people making 80% of the median income or less. So among these 3 categories of folks here, you can see that 72% of the people in this band, in the first band, they are severely cost burdened for their housing, meaning that they are spending 30 to 50% of their income on their housing, which is kind of incredible, right? And so that number is down to 48%, but still, people who are making 50% of the median income, 48% of them are severely cost burdened for their housing, and 84% of them are somewhat cost burdened. So it's just showing you the severe strain that housing costs in our county are putting on everybody every month, every year, every day. And one more piece of geographic inequality. Rob talked a little bit about the 3 areas that we focused on. Another area that isn't to be overlooked is West Marin. So this is an area with lots of farming, ranches, things like that. The infrastructure out there, the roads, is definitely not as robust as it is in the rest of Marin. This population is very spread out. We've got more data collected on this group since the last census. However, the data isn't necessarily that rosy, right? So housing shortages are increasing. There are fewer long-term housing options for people out in this community. There's an increase in short-term rental units. And so many of the workers who provide vital services to the rest of our county live out in this area. And you can see that the poverty rate here in these specific areas is much higher, darker than in the rest of the county.
So these are one of those times we're gonna take a minute, take a breath. That's a little bit of hard data to see about our own community, right? Where we live and where we work and where we're raising our families and building community. So I'd like to ask, does any of that high-level data we've started with surprise anyone? Did you see anything that made you go, huh, I didn't know that, or I'd like to unpack that you want to flag for us? And this question, I should say, also goes to our folks online. How would you like them to raise a hand or pop it in the chat? And can you be sure to state your name?
Maria?
Maria, nice to meet you.
Yeah, I have a long time being like a volunteering in the community, and those data that you have here, as a Latino, as a Hispanic, it doesn't surprise me. And I was thinking about we need more like a child care in the community, like canal neighborhood, because I know there's some moms that they cannot drive, they have no car. You can see the statistics about how much they pay for rent. In some families, they live like 3 families in one bedroom, in one apartment, 1 bedroom. So I can tell myself, my experience. Talking to parents, it's really difficult for some parents to find a childcare in their neighborhood so they can go to work to succeed with their families. So in my case, for me, it's not a surprise. We know that happens because we live in the community. And other thing that I saw there, it is like people that works in services, they have no house where they work. I know so many teachers that they have to live in another county in order to work here.
Thank you.
So in my case, it's not a surprise, but it is good to know where we are now after the COVID.
Yeah.
So now we have to work harder to get where they are. to help the families that are struggling getting food, getting rent, even a job. Because so many things are changing now. Most of our Hispanic parents, they don't know about computers. So it is hard. If you want to apply for a job, you have to know how to do it online. And we still at the times when we used to get the sheet and fill it up and give it to your, a supervisor, someone, but now everything has changed. So I'm happy to know where we are now, but now we have to find a way to get to that.
I thank you for that. I appreciate the themes. What I'm hearing from you, Maria, is you're not surprised by the data, that you're hitting on some of the same touch points: transportation, housing, access to services, job security, all of those things were data points that we looked at. And I really do appreciate the call out to transportation and living out as someone who does live outside the county and commutes in. That's a really powerful observation. I really appreciate it. Anyone else? Yes, she.
My name is Shuda Butler. I have a couple comments that I'm going to read from the chat, but also, can we all yell, please? Because the way our audio is, they have a hard time hearing, so just yell.
Okay.
Before you say something, being able to hear. Hello. The first comment is the number of 65 and older is higher than number of children living in poverty. That's from Children and Family Services. I don't know who it is. That's how they've done. I don't know that that's a question. That was just a statement in here. Vinny Chu stated smaller population sizes are a concern commonly for Asians.
Okay.
Sean Casey says, I was wondering what proportion of respondents were people over 65. That's a question.
Yeah, we actually,
What
unfortunately.
was the question? Can you repeat it? I'm sorry.
Yeah, the question was what percentage of respondents were 65 and over? And unfortunately, this is something we're going to want to improve upon in the future. We didn't ask an age demographic question in the survey, so we can't speak accurately to the number of people that were above 65. The data that we're referencing about the age demographics, that data came from the U.S. Census. So.
And I guess just maybe to build on that, we did some community focus groups, and those groups did have some representation that included folks who are 65 and older, so we included that qualitative data in our needs assessment report and is somewhat reflected here, but to Patrick's point, we don't have the numbers on that.
Okay. Those were all I had in my chat.
I think there's one more back here.
Yeah.
My name is Arthur Bruce, and I served as I'm the former president of the National Homeless Union and a resident of Mariners of Richardson Bay, known as the Anchor Outs here in this county. At our max during the housing crisis, we had 253 vessels, families of people from all walks of life living out on the water. Now we have 51. The county, the BCDC, and the RBRA has they have a contract with the BCDC to remove all anchor outs by 2026, so they're getting closer and closer to that deadline. The community is largely neglected and overlooked by most of nonprofit agencies like CAM. I'd love to see some more involvement. The remaining anchor outs that are still there, they're suffering. It's a hard place to be right now, watching your own community be destroyed. And the storms of winter were just brutal, just absolutely brutal. I can't handle one more atmospheric river. There's times when there was only 2 or 3 people with a running motor on the water, and I was one of them. So it just turned into a full-time job, just trying to take care of what's left of this culture that's being destroyed. And would love to reach out and maybe be able to work with you guys.
Thank you. Thank you for that. And we definitely have the people in the room to connect after the meeting.
Awesome.
Any final questions?
I was wondering about information on the occupations, the jobs that those that were making under $25,000 a year. Is that public assistance? Is that mostly working people? Was there any information on that?
That is actually some data that's coming down the line.
Okay.
Any other questions before we move on? Okay, thanks guys.
All right, and my one thought in looking at the data is we know in Marin County we're aging into poverty as well. So when we think about the demographics, that's also an important part of the county. And to the point about the cost of living, of course, it is so much harder for families to choose Marin. What's the median home price in Marin County, single family home price in Marin County? 1.5 million. Single family median home price in Marin, $1.5 million. So it gives you just a sense of what we're working with and up against in the work that we do. And I want to make the point that it's not just about programs and services. Those are incredibly important to ensuring that our community needs are met. But it's also the important work that we do to advocate for systems level change, for transformations at the state level, the federal level, the county level, to support different ways of working so that the inequities that are built into and perpetuated by the systems we have are changed, and importantly work for the people who do live here or who want to be here and want to stay here. So we're going to talk about this framework and some of the key community themes that we focus on as an agency, but also in partnership with other community-based organizations, and to put in place new laws and policies to support our renters. We know that even though people of color, as you've seen, are about 23% of our overall population in Marin, they make up 76% of our renter population. So when we talk about changing laws and policies to work for people, we have to talk about tenant protections. We have to talk about affordable housing. The work that we're doing and our partners are doing is important work. So again, think about programs and services, but also think about advocacy, because your voice matters, and how we can come together, lift up the stories. Maria, your story, other stories in community that speak to and use the data in service to policy change, changing the laws to work for the people in the county, or again, those who want to be here, is incredibly important. We focus on racial equity, as I mentioned at the outset. Our mission is to move the needle toward greater justice, right? Less disparity across all indicators of well-being for people of color and other folks who are here, where we know, as the Race Count report shows us, that across all of those indicators, education, well-being, life expectancy, we're going to touch on some of those in a minute, people of color are absolutely at a disadvantage. And so Marin County is one of the least equitable counties in the state of California by race. So racial equity, economic justice at the center of everything we do. We are a social services agency, and we focus on many of the important services our community needs, but importantly in partnership also with public health to double down on well-being. And we know that social determinants of health, including food access and transportation, and some of the factors that we're committed to working on, must be brought together with those who are caring for the physical health and well-being of individuals and families, so that our community overall can be well. Family well-being, economic security, housing stability are the cornerstones of how we think about program services and advocacy. But importantly, and these two gentlemen who you've already met, Rob and Patrick, will tell you, data is key. Data sharing, data transparency, disaggregated data that highlights the racial inequities and the economic inequities in our community, so that people can understand, as I said to you, right? When you think about the renter population being predominantly people of color in a very affluent county, it's important to unpack that data to understand those dynamics and those dynamics of injustice, so that we can do better and we can make a change. All right. Family well-being, the goal is the health and well-being of our low-income Children and families are communities who work and who want to go to school to better themselves and the outcomes for future generations. Economic security, long-term resiliency, sustainability, well-being for people to have and to achieve according to their strengths and their dreams. Housing stability, more affordable housing, of course. Tenant protections for those who rent. And strengthening the decision-making abilities that we have to look at disaggregated data across the county in service to these goals. Okay.
Okay, so now this next set of slides, we're going to dig into the data that we gathered in our survey, and appreciate the comment online that when we look at data, sometimes there's smaller data sets, there's complexity in the numbers, and so we try to be clear about sources of information that we have, and some very good points were raised on data. I think it's interesting that in this pie chart, three folks who have spoken up in the room touched on three areas here. And so let me tell you a little bit about the kind of one of the main questions we asked in the survey related to community needs. We asked people to take these 6 categories of community and to rank them in order of priority to them and their family. So this is the percentage of people who ranked number 1 for each of these things. So 32% of our respondents picked housing as their number 1 priority. 24% of respondents picked health as their number 1 priority, and so on through the rest of the pie chart. Now, even though only 7% of people picked transportation as their number 1, a bunch of people might have picked transportation as number 2 or number 3. So just to be aware, every one of these areas was a concern, and we're going to touch on all of them, but this is just to give you a feel for what was the very top of mind. So gentlemen, you mentioned housing, obviously, and ma'am, you mentioned employment. Maria, you mentioned transportation. So what you'll see as we dig into the slides, we ask questions about each of these areas, and you'll see some of that data come out in some future slides.
Good afternoon, I'm Laurel Hill, and I'm the Director of Safety Net Services at Community Action Marin. And as Rob just shared, a significant number of people said that housing was their top concern. And within that category, some of the things that they talked about were lack of affordable housing and lack of rental assistance for people that did have housing, and then the high cost of utilities. I think we've all experienced that in the last year. And then this slide here is showing that rents in Marin County are very high. It's one of the, I think we're the number 2 highest, most expensive place in California. I don't know who got number 1, but number 2 is pretty high. You can see how it compares to the United States as a whole. Over the last 3 censuses, rents have gone up everywhere, but faster and higher in California, and much more in Marin County, as you can see. And notice this is data, the last data is from 2021, and this is the median month. So today, in May of 2023, the fair market value for a 1-bedroom apartment is just over $2,600 a month. That's 1 bedroom, and that's a lot of money. And so again, affordable housing, I think Rob talked and Patrick both talked about, what housing is available and what's affordable. I think Patrick mentioned people that are paying more than 30% of their income. So that's what's considered affordable, is if 30% of your income is going to housing and it still leaves you room for food and things like that. And so if you were making minimum wage in Marin, then your 30% housing, I think it would be about $970. And that includes like PG&E and things like that. And as we can see, there is no $970 place to live in Marin County. And what you can see, if you just go back to the last one real quick, is that on the left, we see these are all the people that are very low income and extremely low income. And not just low income, but very and extremely. These are those people, to your point, Shayna, that were making less than $25,000 a year. And on the right, we see on this column that's what affordable housing is actually in existence in Marin. So more than half of the people that need that housing, it's not there, it just doesn't exist. And these are some of the comments that we got. People were saying if Marin would just open up the housing voucher wait list. So in that affordable housing, that's Section 8, those are other subsidies, and as a lot of people know, that list has been closed for years, and if you're on the list, it's a long wait. It could be years and years before you're eligible. And people that are working and able to go look for an apartment are finding that the deposit now is huge, and landlords are often asking people to prove that they actually do make 3 to 4 times the rent so that they're not housing burdened. And so people are being just cut out of the market, whether they're willing to pay more than what's reasonable or not. And then just the lack of low-income housing, as we saw in the last slide. And so these are some of the things that Community Action Marin is doing in terms of addressing these really high-need housing issues in Marin. As you can see, last year we provided 306 households with rental assistance. This year, so far, here we are in May, we've helped 386 households. That was last week. By the end of this week, it'll be well over 400, I'm sure, and the need is just continues to be there. And as Chandra and Rob talked about, it's advocacy. It's not just we're helping people in the moment with their immediate needs, but also talking about policy and, as Maria said, what's next for people and what can we do as a community. And so that is one of the things that we do as an agency, is we partner with others in the community, with other agencies, to really advocate for lasting change, like the creation of more affordable housing. We have a homeless outreach teams. We have a number of people that are working out in the community, serving people that are currently unhoused. And so on any given month, we've got at least 60 people that we're working with. And Marin County uses a housing first approach. And what that means is that it's saying that everyone deserves to be housed, everyone, that there shouldn't be, conditions on that there shouldn't be, hoops you have to jump through. And so it's not saying you deserve housing if you go through this program, or if you do this training, or if you get sober. It's saying, no, everyone deserves housing. And I think that we would all agree that it would be easier to address other issues in our life if we could do that while being housed. We also, in our safety net services, in the last year, we did distribute more than $2.8 million in assistance, and that included housing deposits, rental assistance, and also we probably provided close to 1,000 households with assistance with energy, which is primarily PG&E. But for people out in West Marin who are using wood or propane for their heating, we can assist with that as well. And we're working again, you saw some of those income charts and where people are. We're working with the people that are most vulnerable, that are the lowest income. And as you can see, over 2/3 of the people that we're serving earn less than 30% of the median income, but more than 80% are earning less than 50% of Marin's median monthly income. And what that's saying is that more than 80% are not earning a salary that would enable them to live in Marin County and pay all their bills and not need some form of assistance. And I think Rob was talking about where people rated things, and the number 2 right after housing, people said healthcare issues were important to them. And I think we also saw Marin County is the healthiest county overall. And the Robert Wood Johnson Foundation does a survey. They look at all kinds of health factors in communities across California. And Marin has been #1 every year except once since 2010. And that sounds like a good thing, but as Chandra just said, we're also one of the most inequitable places to live in the state of California, which also means the entire country. And so you look at these differences. This is what the inequity looks like, is that if you live in Marin City, your life expectancy is 76 years. In San Anselmo, it's 91. That's a huge difference. Child mortality rates in the Hispanic population are 3 times that in the white population. In teen pregnancy in the Hispanic population, 21 times the amount in the white population. And so that healthiest it's healthiest for some, but not for everyone. And it was a #1 concern for 24%. And as Rob said, people had number 1s, 2s, and 3s, and it was top 3 for 72%. So that is a lot. And again, you can see like the inequities is somebody said, I feel discriminated against when I go to clinics, and it makes me hesitant to even try to get assistance. And then within health, 35% of the people that we surveyed ranked mental health as a top issue. And I think a lot of us know that in Medi-Cal and some other programs, there aren't mental health solutions for a lot of people, for families, for people that don't have what's considered significant mental illness, for children. And our staff in our homeless outreach team have all noted that, yes, the people that we're working with in the homeless population, mental health is a really big issue for them as well. And so again, it's just the inequities, the access to benefits and the cost are real barriers for our low-income residents.
Okay.
Thank you.
So we did a bit of deep dive on housing and on health and safety net services. Let's take a pause. How are we feeling? What are we thinking in terms of alignment with your greatest concerns, with priorities, with gaps? Any observations? What about online? Shiva, we got anything?
Nothing so far.
Can't help but notice, sorry Shane to do it again, I can't help but notice that I think in the mental health statistics that it's 35% cite mental health as an issue. Was I reading that right? I wonder how we allow for the understanding of the stigma that goes along with mental health for these populations and an admission or an understanding of what real mental health needs are.
I really, just to restate that for folks online who may not have heard, so Shana pointed out that statistic on 35% for mental health, how much that might be impacted by stigma, and whether that would, am I summarizing what you said correctly, that whether or not we are, the accessibility of those services, the need is really reflected even in that number, because there's, like you said, it's probably not fully accurate.
Right, and are there services that we could provide that would speak to that stigma and help families understand a little bit more, what that looks like.
Right. Other thoughts, questions? Yes, Maria.
Yeah. Well, I'm gonna say in Spanish.
That's just fine.
Translate me. Mi enfoque ahorita es
Lo hago
saber.
a la vez. Do you guys want me to do it at the same time? Okay.
Whatever's easiest for you.
Okay, perfect.
Mi enfoque ahorita, después de ver el slide, es acerca de la muerte de los niños hispanos,
The death of the Hispanic children
que es más alto que otros
that is
grupos.
higher than other groups.
Se tiene datos de cómo suceden estas
How
muertes.
that happens? How this death happens?
Mortality rate, the difference in mortality rate. Robert, Patrick, give me insight into the question was around mortality rate and the differences of Hispanic children. I think it was 13? Three times the high number?
Yeah, so that data came from some county health statistics. We've got we can give you the exact reference, and it's more just giving the numbers. But I believe the implication there is just the quality of healthcare that is available and accessed by people of different groups. And as a result of those inequities and being able to get appropriate health care, that metric of child mortality is much higher for Hispanic group. Is that what you? Yeah, I don't have all the answers why, but I know those were the numbers from the health statistics, and I'm speculating others may have more information than I do on maybe the cause.
In my thoughts, I have some families that have talked to me about they sometimes don't, as it says on the health section, they don't really bother to ask for health, services, because they don't feel okay to go to the clinic. It takes a long time to get an appointment. Sometimes even your child, it is getting better when you have an appointment. About September last year, my daughter got sick. She is 5 years old, so I took her to the doctor. And just because we were like really concerned about her, and we asked for tests for whatever she needed, that's when the pediatrician decided to do a flu test to her in COVID. And she was with flu. It took me 1 day going back and forward to the clinic, asking for the la receta?
The recipe, the
The prescription to be sent to another pharmacy because the medicine for the flu, it wasn't available. So I went to 3 of the pharmacies to get it. And she was like that about 3 days when I got that appointment. So you can imagine how many families could go through that. And as I said, I was lucky that my husband wasn't working, and we were, we went everywhere to find out that medicine for her. But there's some more families that they cannot do that. In some of the families, they don't speak English. So if you don't speak English and you don't, ask and they're not gonna give you anything for your child.
And we have partnerships with, for example, like North Marin Community Services, and we talk with them regularly, and we do meet as part of the throughout the county, there's a system of coordinated entry, and so everyone that's working on homelessness issues is working within that same group. And we continue to look for ways to partner with other agencies, other groups, and to bring services into really specific and underserved communities.
And then I have another comment from Debbie Rogers, who says, when I think about mental health services, my mind goes right to a person going into a private office and talking to a therapist. I feel that understanding what support looks like for different cultures can help to shape other ways to provide support and shift the mindset of the stigma.
I really, really appreciate that comment. How are we on time right now?
1 hour in.
Okay, all right. We're gonna...
All right. Good afternoon, everyone. My name is Heather Bettini. I'm the Senior Director of Economic Justice. And my voice is a little strained. I apologize. I'm not sick, but just experiencing that. So I'm going to talk to you about some more inequities, so kind of building on this theme. And just want to preface with, these are really symptoms of long-standing institutional and structural racism that has penetrated our entire society and culture. And so, these are the outcomes that we are seeing as a result. So just to talk a little bit about the unemployment rate in Marin County is consistently low. And when we disaggregate by race, we can see that among the people who are working, the median income is very different for people of color and for white and Asian people. Less than half, for example, in 2021. So they are working and they are not able to make ends meet, right? And so these are some stark inequities. Thank you. And then we talked a bit today already about the housing burden. The cost of housing is so high. So here, renters need 3.5 times the minimum wage of California to pay rents in Marin County. So what does that look like? Over $9,000 a month is required in order not to pay over 30% of one's income on housing alone, which is what cost burden means. We need to have enough money for childcare and transportation and healthcare and food and other, expenses. And so this gives you a little picture of there's the state minimum wage is right below at $15 an hour, and then what other industries are paying. So healthcare aides at just under $17 an hour, childcare workers, retail salespeople, and medical assistants, and all of these are far below it's almost $53 an hour that's required not to have a housing burden in Marin County. So just calling that out. And the other question is, who are in these positions, right? Like our frontline workers, people who are cleaning classrooms, people who are teaching our youngest children, they are often people of color. And so next is what are we doing at Community Action Marin to alleviate some of these causes and consequences of poverty? And we really want to think with you about, are these the right strategies? So I'm sharing with you what we are doing. We know there's more work to do because we're not where we want to be. We don't see equitable outcomes in this county. So first want to share that we have a registered apprenticeship for early childhood education teachers. We just launched. We were the first partnership in the state of California under a state sponsor that does this work regularly. So we have 19 apprentices that are placed at our agency and a partner agency, North Bay Children's Center, and they're all taking classes at College of Marin. Almost all of them are women, and almost all of them speak Spanish as a primary language. So many of them are enrolled actually in their early childhood education courses in Spanish. They're taking the class in Spanish, and they're taking ESL classes. They're trying to gain English proficiency as they go. And I do want to mention that you saw on the previous slide that workers in this field are not making enough money. So in addition to the work of direct service, we are advocating for higher wages for these workers. These jobs in early childhood education are typically held by women of color, and it's undervalued. It's not seen for what it really does for our workforce. What would we do without childcare? How would we I wouldn't be here right now. How would we get to work without our childcare workers? So just want to highlight that. And some of that is through the way our agency is reimbursed, through contracts and other ways that we're advocating to increase the wages of those workers. And then we have a driver training, so people in 6 weeks can get a commercial driver's license. And people are really desperate for workers in that field. So it's a very quick way to get a job right away. And starting wages can be 25-ish or maybe a little more per hour. There's just a lot of demand for drivers right now. And then we have a program that's a bit more open, and it's not a specific field, but it's for people who are experiencing employment barriers and who often are struggling just to meet their basic needs. We're helping them through stabilization, getting into job training programs, whether they're job training programs we offer or those that are offered out in the community, for example, by Homeward Bound or Canal Alliance and other trusted partners. And then finally, employment placement, very important. We're working with them. It's not just, here's a resume, good luck, go talk to some employers. We're helping them through that piece and making connections with employers. Oh, thank you. Perfect. And then finally, outside of our workforce development programming, which is what I just shared with you, we have SparkPoint Coaching, which is a model that's being delivered all throughout the Bay Area in partnership with United Way Bay Area. And it's a one-on-one coaching relationship to help people think beyond actually their basic needs. A lot of what CAM does is to meet the needs and survival of today, but we're also thinking with people on mid and long-term strategies for where they want to go. Do they want to purchase a car so that they can have more opportunities to work outside of their own community? Do they want to save for their child's education and their own retirement? And what would that look like? What would that take? And okay, am I going really, really fast? Sorry, it must be hard for the translation.
And online too, so.
Okay, am I loud enough? But
Can we advance the Spanish slide, please? It's one behind.
oh, thank you. No problem. No, I appreciate the feedback. And so we're building plans, and we're helping them do things like increase their credit, decrease their debt, increase their savings and their income. So really financial empowerment at the family level, individual level. And we have trained coaches who work with them one-on-one to identify their plans and to transfer the skills and knowledge they can utilize throughout the rest of their lives, making informed decisions and supporting their own communities. All right, I'm going to pass it off to my colleague Betsy.
Thank you. I actually have a question from the Spanish chat.
Okay.
She says that she believes that in the Spanish community that we need more information, that oftentimes we don't go out finding resources because we feel, because we feel that there's a lot of limitations, like with finding housing, there's no rental protection with evictions, there's really high rent. And I would also like to have information on how to be a first-time home buyer. These kind of information for Latin community would be very helpful for us because a lot of the times we're afraid because we lack documents, meaning like paperwork. We lack paperwork, and a lot of people, sorry, type up here. I think she's saying that oftentimes when we're a part of a church, we can earn more money, but if people aren't part of a church, then we're left without resources. And I would like to have more information in regards to this for our community.
Shall I respond now? Okay. So a couple of things that we're doing to address some of the themes that I was hearing are bringing our services out into the community where they are most needed. So not just, having people come to us or working over the phone, but going out, and a couple of examples are recently in West Marin. This Thursday, we're about to bring services to Marin City. College of Marin is another one to meet the needs of students. And it sounds like maybe in some of our Latino communities, there's a need here. We've hired a bilingual financial coach who is sitting here in the audience and is able to offer these services in Spanish, which is wonderful. It increases access for more people. And we need more ideas about how to reach out and maybe make it more accessible and feel like, oh, I could do that. It might seem hard and it might seem intimidating if we haven't had that information growing up, or really financial institutions are so different in this country if someone's coming from somewhere else. So just, we really are meeting people where they are on a scale of crisis to thriving, and really trying to integrate our services to bring a bundled approach to, they can get their needs met across the entire family, across generations. So I'll just share that for now and hand it off to you, Betsy, for the next section.
Thank you, Heather. Well, good afternoon. My name is Betsy Basin, and I'm your Food Justice Manager. And I participate with CAM with just about all food needs for every age in our community. It's a job I really enjoy doing. My first slide talks about, food insecurity, and we were looking really good in 2021, where Marin was at 7% and California was higher than us. But in moving to this new year, Marin went up to 8% in insecurity, but California dropped. Now, in hearing all of the information today, I think food insecurity is definitely linked to the high rates of housing in Marin County. And in hearing all of the data, it did, it's like, wow, we have a big job ahead of us to try and help balance the needs of our families in this county. On the second half of my slide, it shows the schools with the highest rate of students that are receiving free and reduced meals in the programs at the schools. To receive free and reduced meals, you come from a family that has low income. And you can see in these different schools, we find that they are in low income neighborhoods and more students are of color. San Rafael, we have 2 schools in San Rafael City, and we fortunately have preschools near these schools, so we are supporting these areas. Hamilton, we also have a preschool in the Hamilton area, or the South Novato. Marin City, we have a preschool. So I'm in West Marin, also over at Tamales Elementary. We are partnering with the schools. Our preschool families go into those schools, and sometimes the food resources in the elementary schools can be enjoyed by our families in the preschools that are close or at site. So I have the wonderful job that I get to provide food to our families that participate in CAM's preschool programs and after-school programs. Each month we serve over 11,000 healthy meals. This is one of our sites at Hamilton, and they're having lunch together. We also have programs for infants and toddlers, center-based and at homes, family home programs, and then our school-aged children where they come to our program after school and they get to have a healthy snack. What does this mean for our children and their families? Well, while they're eating, they're learning about what a healthy meal is. And I like that sometimes the children take that information home to their families, and that's really exciting that they're sharing what they're learning. Also, we help children mainly under the age of 5, but we have a new program that we started this year where we're serving meals to the seniors in our community. And they're called congregate meals. They're happening throughout the county. Right now we're at 6 sites, and they are at community centers. And we serve over 1,200 lunches each month. Now, where's all this food coming from? CAM has a commercial kitchen located in San Rafael where we cook hot meals every day for our students that are center-based, as well as our seniors when they receive their congregate meals at the various community programs. And we have, this was one of the reasons I came to CAM in December, we have a production farm at our Old Galenas Children's Center where we produce, well, this is 730 pounds of fresh produce was produced last year, and we've started to harvest this year. We're up to about 8 pounds, and it's still spring, so we'll see what we get at the end of summer. Here's a picture of, this is a part of our production farm here. It's part of the orchard area, which we are currently renovating. So what do we grow on our farm? Oh my goodness, we have an amazing lead gardener named Juan. He's fabulous. He grows cucumbers, bok choy. Yes, our children love bok choy. Cabbage, cilantro, kale, carrots, collard greens, lettuce, tomatoes, zucchini. We have a fabulous hoop tent that allows us to grow in this sometimes cool weather in Marin. As I was saying, we are currently renovating our orchard area because CAM has started a new program called Appetite for Change, where we have partnered with Occidental Art and Ecology Center, and we are designing a program. It's going to be 7 weeks long, where we have 12 families come learn how to garden. From beginning to end, getting the soil ready, planting, harvesting, and then how we started again with the next season. Our course will start, we're starting in August, and it will last 7 weeks. Very excited. We're hoping these 12 families can take the information back to where they live in their communities and start more mini gardens throughout Marin. Why is that? To help with food insecurity, so you can learn to grow your own food. Are there any questions? Okay, thank you very much.
Oh, I guess in the meantime I can say good afternoon. My name is Norma Medina. I'm the Director of Enrollment and Eligibility Services for our Children and Family Services. You want me to yell? Okay.
Mom voice.
Yeah, mom voice. Mom voice. Right. Oh, there we go. There we go. Okay. So I'm just going to share a little bit about the families that we serve. The families that we serve fall under our federal or state income guidelines. They primarily will meet one of the categorical eligibilities here, like homelessness, children in foster care, children with disabilities, or families receiving public assistance, which since April of 2022 has now included CalFresh. So if family is receiving CalFresh, they are now eligible for Head Start services. So that's really good news. It makes more families eligible. for our services. As you can see from the data, it says here we have a little over 1,000 children under 5 living in poverty in Marin. And Community Action Marin has served over 1/3 of them so far, year to date. And this would include a little over 160 children with special needs. And as we continue to support our staff with this teacher shortage that we've had, as we continue to support strengthening our workforce, we look forward to actually moving to our full capacity of serving over 550 children.
So there is a gap between white students and students of color. So that is significant, and we wanted to highlight that for you this afternoon. In our education and child care service, I'm happy to share that we do offer infant and toddler care for children ages 0 to 3. We offer toddler and preschool age care for children that are 3 to 5 years old, as well as after school care. We are in a collaborative effort in grading our funds and our systems with Head Start, the state, and the California Department of Education. I also am glad to announce that our satisfaction survey reflects that 98% of parents said their children are happy, safe, and feel like they belong. 94% of parents said that this care helped them with employment, education, or caregiving issues. So happy to know that our children are being cared for so people can work and take care of their housing needs and all the other needs that we have talked about previously. These are a few comments from parents and our partners in community. We have a parent here that shared, when my daughter comes home, she tells us her experiences of her day, and it makes our lives very happy to know she is living a happy life with those around her. Thank you very much. The CFS program, Children and Family Services, is very helpful both in my emotional health and relieving some stress. And lastly, we had a family share out. Thank God for this program. We can work.
All right, well, the last 2 of the 6 areas of need that we mentioned early on in that pie chart are safety and transportation. And so these were areas that people also commented on. We've discussed a little bit so far. In the area of safety, we're fortunate that Marin has low rates of violent crime. The crime rates for nonviolent crime are pretty comparable to many other parts of the state, and that was an area of concern among some of our families. And particularly, another area in safety among our the subpopulation of our early childhood education program parents. There's concerns about fear of deportation, and so that's something that CAM has to keep in mind as we work with these families, helping them access benefits. That's a real concern, and I think someone mentioned that as well in the chat, having documentation and paperwork. In the area of transportation, as you will not be surprised, overwhelmingly it was cost. Cost of vehicles, cost of fuel, cost of insurance, maintenance, etc. So that was the biggest concern by far of people in our survey was cost of transportation. And that ties back into where do people live. Many people have to commute in from outside the county, and so especially even with the recent increases in cost with inflation, really puts a strain on people's transportation budgets as they're trying to save money by living further from where they work in the county. Public transportation, limitations to public transportation was another big concern, and out in West Marin in particular, where there's very little public transportation, back to the comments of people trying to access medical care, trying to get to services. And I think one of my colleagues mentioned before, I think Heather mentioned, CAM, we're trying to take some of our services out in the community more often, and we're going out to some of these other areas with either pop-up events or having the ability for people to sign up for benefits or sign up for some of our services in addition to coming here on site. Okay, and finally, the last slide of this set, we've talked a lot about the needs and concerns and inequities, and those are all very real and inform the work that we do here at CAM and others do in our county. But there's some very interesting data from an organization called Opportunity Atlas that actually gives some positive information, some kind of positive data related to upward mobility in Marin County. So what they do is when they look at children growing up in low-income families in different counties in California, Marin County scores actually very well, and this is for all populations, including Hispanic and Black children. Their modeling and their data suggests or predicts that 21% of children growing up in low-income families will themselves become high-income adults, and that 44% of children in Marin County growing up in low-income families will graduate from college. And so those are that's some good news there. And and my understanding that the research talks about this is one of the benefits of living in a very high-income area is there's an effect there because there are good quality schools and other services available, and so even if you happen to be in a low-income population, you get some kind of spillover from some of those benefits into your life as well. And so that is, again, a bright spot that this particular data shows the benefit of living in this wonderful county.
All right, so we've looked at the data, we've talked a bit about the work that we do, and so this is really our final chance to touch base back on those guiding questions. I know, I think I saw quite a few things pop up on, no, is that those are old? Those are old ones, okay. Thoughts and observations?
Hey, I got one. I know like there was earlier questions about...
Fatai, can you say your name and who you are?
Oh, sorry, my name is Fatai. I work for CAM. I'm with the outreach team, with the care team. My thought is with this, I think there's a lot of stuff bringing up with this report. There was a previous questions about more networking with other agencies. I know there's, like right now, there's a lot of that already, but we also missing, I think, just from experience being on the street, that we're missing some of those still. Especially in areas where I would see as target areas, especially the Canal, Marin City. I don't know if my numbers are right, but I think a few years ago, 15% of the population of this county is in the Canal, and that's a lot. And then just by looking at all the numbers, the schools, Bahia Vista, San Pedro School, even though San Pedro is in a very rich neighborhood, all their kids are being bused from the Canal and other areas of the county into that school. Bahia Vista is right there, but even like some of those numbers, and I'm thinking there are tons of agencies in the Canal too, like Canal Alliance. We've been trying to work with them, some windows have been closed, I don't know, but that doesn't mean we wanted to open some other windows too. So we go the other route, like you close the front gate, we'll go look if there's someone open the hole on the side. I want to get in more to the Canal and also Marin City, target a lot of the, families of colors. There are people who have the rights to work. There are people who doesn't have the right paperwork to work. So there's all sorts of stuff. And I understand the county have the healthcare fair or something, health information fair that they do like maybe once every 3 months, every quarter. I don't know if they have done one in the Canal or Marin City. Like I'm looking at those two, sort of like I want to target those two areas. I'm also looking at people who live on the boats, like San Rafael Harbor. There's a lot of people there too. You know, we can do pop-ups. We can invite other agencies that have maybe some of the services that they can provide for those folks. You know, but I know there's a lot of work out there. People are doing it. Maybe they're not really. A lot of people doesn't know how to connect to these services. Maybe language barriers. Maybe easy access to like information's online. You know, but we can always do more.
I really appreciate your observations, Fatai, and I think it's really well timed what you're saying and also where you're sitting, because you're sitting next to one of our newest members at CAM, Marin or Mo, who's our Director of Whole Family and Community Services. And this is a huge, her position is a testament exactly to that kind of commitment, right, that CAM has to be in partnership with families and communities and the agencies that they serve, and that, you know, I'm watching her take notes on her, but that's exactly that, and that's, you know, from the little time I've spent onboarding to Marin, one of the observations I've heard is CAM does incredibly important work and they're at a lot of tables, but there's many more tables to consider. I think it's great to have alignment here. Other questions, comments, thoughts, observations? Yes.
I'd just like to say this is extremely timely and helpful for me, as I've just joined CAM and just come to California itself from New York. So learning more about the area and the issues is great for me. I feel like what I am noticing is that we are working a great deal with families, which is awesome and what we should be doing. But I wonder about how much work we do with actual agencies themselves in terms of changing their approach to the way that they deal with our families. Just looking at the economic justice piece, and, you know, do we partner with lenders or banks or, you know, in the areas where our families are to help prepare them to interact with our families in a different way. Same with mental health facilities, the health clinics that Maria was talking about. How much different would those interactions and those situations have gone had the personnel in the institutions had a better perspective or a better understanding of the population that they were serving? And I mean, I don't know if we do, we may, and then perhaps that's part of their overall training, but I wonder about those things in terms of changing you know, higher systems overall, but then at the ground level as well.
Chandra, or anyone, you want to speak to that?
Okay, just a couple of ideas on your inquiry.
Heather, can you stand up and
Oh,
speak
yeah.
just a little louder?
Yes. Heather, hello again. A couple of ideas on your inquiry and what we are doing. So we recently had a site visit with Redwood Credit Union in San Rafael, pretty close to downtown. And we already refer a lot of people for their kind of second chance credit building products and tools. And we do this in all different languages through an amazing interpretation service that we have at CAM. And they are totally on board. So there has been like a direct connection around here, the type of people we come with and the barriers they face and what their needs are. So if they come to you, this is what it looks like. How, you know, how do you approach that? Do you need support? That, and then in our newer partnership that's developing in Marin City, we've got 4 excellent partners who are coming to bring services and care deeply about this community. And it was all very fragmented, the way this was happening. So my first thought is, if I'm an individual who lives in this, 700 people live in Golden Gate Village, low-income housing in Marin City. If I'm one of these people and I come in and there's different partners coming different days of the week with different services, I'm out already, it's too much. So CAM has led a conversation around just starting simply, what if we have one flyer that explains all the services, all the partners, all the logos, and all of us, and what we are doing together? What if the partners meet before we launch and talk about what each of us does, so we can actually understand, as we're hearing stories, assess for the needs, and conscientiously refer to the right place at the right time? Can we continue to meet and kind of figure out better ways of partnering to meet the needs of people that are coming in with respect and dignity in their experience.
I would love to talk about Hamilton's Garden, wonderful. And interestingly enough, just today at 3 o'clock, I'm meeting our Marin County's Health and Human Services manager to walk through the garden and discuss how we're going to get it up and running again. During the time with COVID, everything sort of stopped, and we have focus right now on getting the production farm up and running, and Hamilton is right there. They're our next site to get going. Love to get your name and your information so you can be part of our group to start it up again. We had a Earth Day event at Ogalinas where we partnered with a group called Children for Change, where they helped us at Ogalinas, and they've offered to help us at Hamilton also. And I think we would like to have a cleanup working day in June if you're interested in participating in that. But yes, I really hope those gardens get up and running. And I also wanted to say, Maria, that I am part of a collaboration with Marin Community Clinics called Practice. And that's where I meet with 3 of the leads with their pediatric chronic health concern team. And we talk about how we can communicate with our families that are trying to get the care at MCC. They have a new phone center that's very hard to navigate. I go on it and I sit on the phone for an hour. It's really challenging. Yes?
I rather go and do my appointment with them instead of calling.
Oh, you just go?
There's no answers. I rather go, talk to the receptionist and do my appointment. Otherwise, but that's what I mean.
Right.
Some families that can drive, they live too far. I live by San Rafael High, but I drive.
Do you go to the one in Nevada?
No, to San Rafael.
Oh,
but instead to use my phone, I rather go and do what I need. Otherwise, there's no people there.
Right. They are working hard to make the partnership stronger, and there is a grant coming up next year to extend this chronic care unit for pediatrics to all families. So we meet once a month and try and work out the challenges that I experience from our families and the challenges they are experiencing from their clients. So they're working hard, but right now not everyone feels that they're working hard to achieve those barriers. So yes, Hamilton, I'm there today at 3 if you want to join the group, and we'll get some things planned too. Thank you. Thank you.
All right, well, first and foremost, I want to appreciate all of you online and in the room. Thank you so much for being part of today's discussion. I want to say on behalf of our staff, I think we've learned a little bit. I think we've listened more deeply. I have no doubt that everyone here has some ideas. Inspirations, certainly. Possibilities, definitely, for how we can continue to partner better, stronger, and be a better community together across a variety of stakeholders, including our individuals who are homeless, including people out on the bay, including families with small children, including families with older adults, including people who have lost a loved one and have aged into poverty because they can't pay their medication and rent. All of the individuals who are part of Marin County are with us as we think about how our agency, in partnership with you and others like you who care about our communities of color and families of low income, individuals of low income, can move equity and justice forward in Marin. So thank you, and if you don't mind, if we could give the team a round of applause. I want to thank them for all of the hard work, all of you who are helping with the operations, with the data, with making the programs happen to create thriving outcomes in our community each and every day. It takes a village, and indeed we're stronger together. So thank you for being here today, and we'll look forward to sharing our community action plan update with you on the website as we take in this information, absorb, reflect, and then are able to iterate for our state plan. And as we continue to share with you, we'll make the video available, and we'll continue to take your input over the website or email. Any additional inspirations or ideas you have, we're open and welcome during this window. And Rob, what's their deadline for getting us additional feedback, input?
That's a good question.
Next couple of weeks?
Yes.
All right, so the next couple of weeks we're
Say
open, but
how about end of May?
end of May.
Okay.
Thank you all for joining today. Appreciate you.
If you didn't get a
And if
chance
you
to
didn't sign in, do so. Thank you.